Hello, my name's Lisa Laycock and I'm the sister who runs the Renal Transplant Clinic here at Manchester Royal Infirmary. So just really to talk to you about your experience that you will have in the clinic once you've been discharged from hospital after your transplant. You will meet members of the clinic team, which include the nursing team, the transplant surgeons and the nephrologists, the pharmacy team who've already spoken to you earlier, and will also be nursing assistants, phlebotomy staff and clerical staff as well. So following your discharge from the ward, you will come to clinic initially twice a week. Usually that would make up of one visit to be seen by the doctor and the other visit to be seen by the nursing team to have your blood tests and review. If obviously you do need to see the doctor on that day, then we would arrange that, but that would be the format that we would try to follow. Your frequency of visits will decrease over time, so they'll go from twice a week to once a week, and then we'll get to a minimum of every 3 to 4 months in the long term, but it does take about a year to 18 months before you would reach that level of follow-up. After the initial post-operative stage, some of your appointments will then move to telephone or video link, which will avoid you having to spend so much time in the hospital. We do aim at 3 months' time to have our patients back to their referring hospitals for those who live outside of the Manchester Royal Infirmary catchment area. And they will take over your long-term care and follow you up long-term. So what actually happens in the clinic? Well, it's like an extension really from when you're in the ward. We'll certainly manage your weight and your blood pressure. You'll have blood tests and urine tests as necessary. Any wound care management we would look after in the early days after your transplant, so in terms of your dressings and managing that, so you wouldn't need to have district nurses coming to your home. Most likely we can take care of all that for you in the clinic. You will have a medical consultation with the doctors on the days that's needed, and also pharmacy review at certain points, and the nursing team are always there to offer you any support and advice that you might need. In the early days, we say appointments can take a little time, particularly if you do need to see the doctor and the pharmacist and have your dressing changed and bloods, etc. So we do say allow about 1 to 2 hours initially, but moving on from that, then the visits should get less lengthy. Outside of the clinic times, the nursing team are always there to offer you any advice, and we're available on the telephone in the afternoons, generally between 1:30 and 3:30, so you can always ring us if you've got any queries or anything you've forgotten to ask in the clinic. We also have patient view available that patients can sign up to. Some of you maybe were familiar with that from your other hospitals or you've been on it previously, and that allows you to be able to see your own blood results online, download the app and be able to keep a track on how your kidney function is doing. Clinic setup. So our clinics are held each morning in the main outpatient department here at Manchester Royal Infirmary. They start at 8:30 and run till around 11:30. So we will give you an appointment within that time frame, so we do ask if you can, where possible, try and stick to your appointment time so we can avoid having long delays of people waiting in the clinic. In terms of transport, the hospital will provide transport for anybody who needs it to come to the hospital for the first 6 weeks after their transplant. That's because obviously during that time those who drive are unable to drive, and we wouldn't really advise that you come on public transport at that point. But after 6 weeks, that would stop, and those who do still require hospital transport for any other medical reasons would then need to get that via your GP. So in terms of the clinic follow-up, we're really looking to support you with long-term follow-up after your transplant. All transplant patients are followed up long-term, whether that be still here at MRI or back at your own hospital, and we really want to help you to support you to maintain a healthy lifestyle, eat a healthy diet, make sure that you've got the advice you need to support you taking your medications as you need to, and that you don't run out of any supply or miss any doses. It's important for us to help you, that you can attend your appointments regularly so we can keep an eye on how things are doing for you. And we're always there to help you on a range of matters, whether that's in the early days, advice about getting back to work or going away on holiday, or even more longer term family planning, protecting your skin and any general health promotion advice.